CARDIA is brought to you in part by H.D. Smith Foundation, a private grant-making foundation in Springfield, Illinois. Abraham Lincoln Capital Airport, daily flights to Chicago on United and to Dallas on American Airlines. Online at flyspi.com. Eck, Schaefer and Punk, LLP, and ESP Wealth Management, LLC, specializing in fulfilling all your accounting and wealth management needs. Securities offered through First Global Capital Corporation, member FINRA and SIPC. Investment advisory services offered through First Global Advisors Incorporated. Prairie Heart Institute, nationally recognized, locally committed. Online at prairieheart.com. And viewers like you, thank you.
Hello, welcome to CARDIA, Hearts and Sciences. I'm Mark McDonald, pleased as always to bring you the program dedicated to the understanding of the human heart with our co-host, Dr. Greg Mischkel, who not only is co-host but is also the Executive Medical Director of the Prairie Heart Institute at St. John's. Dr. Mischkel, we're going to talk today about a breakthrough in helping patients get ready for and recover from surgery. And you know, I think one of the things that most patients hate about surgery is that they don't know what to expect. And we've come a long way, haven't we?
Well, you know, we undertook this project and we reviewed all the pieces of paper that we give patients as part of their education before, during, and after their surgery. And I think we stopped counting at about 75 different pieces of paper.
Yeah.
So we realized, and as the older you get and you go through surgery, you realize that you really need something better than just 75 pieces of paper. So we've come across an app that you can put on your iPhone that will walk you and your family through the cardiac surgery process.
That's terrific. And Amy Durako, who's a nurse practitioner with St. John's, is here because you sort of run this program. I guess you make sure.
Not sort of.
So, oh, she does run it.
She does.
Okay.
Yeah.
She makes sure that the notices get to whom they need to go on time. And it's fascinating because you walk patients through like a week ahead of time. And you start getting them ready for surgery so they know, when to stop taking medicines and all these kinds of things. Mm-hmm. And even where to go on the day of the surgery. So it's not, where do I park? Where do I go? What time do I show up?
Correct.
When patients have talked to you about this improvement, how have you sensed that they've become warmer towards surgery or feel better about it?
They're much more comfortable with the entire process. We sign the patients up for the program during the surgical consultation when their surgery date is scheduled, so they start receiving notifications immediately, and it truly walks them through every phase of the process, from pre-op, in hospital, to after discharge.
But not just the patient.
And their family.
Their family.
Mm-hmm.
So you may have a reluctant patient who says, I don't know how to use an iPhone, but we can set this up so that the family gets the same alerts and can help the patient through.
Now, I was enrolled, and this was a mock enrollment for me, but I was enrolled so that I would learn how the program works. I chose to get mine by email. You could get that on your phone or your email, and so I got mine on my computer, and every day, starting 7 days before my surgery, which, by the way, we might see a little bit of during this program, it was a single bypass and a surgical ablation surgery. So when you see the surgical pictures, that's not me under there, but it's supposed to be. Anyway, so I got that's when I started getting mine, was 7 days ahead, as long as anybody would. And this is what I got on day one, 7 days. In this program, it says, Dr. Gregory Mischkel has signed you up for the Prairie Heart Institute online surgery self-care program. And in this program, you will learn what you need to do before surgery, what to expect during surgery, how to take care of yourself after surgery, and how to manage common problems after surgery. And so this is where you start, isn't it, Amy? And you start getting people into a groove, kind of.
Correct. You start engaging them from that first interaction.
And then the next one I got was, it's 7 days before your surgery. You should stop taking your antiplatelet medicines. That's important, isn't it?
It is important. Many patients are on antiplatelet or anticoagulant medications because of other health problems, and it's imperative that they stop those medicines before surgery to reduce the risk of bleeding and complication or case cancellation, which we've seen in the past if patients have failed to do that.
Yeah. Dr. Mishko, you're aware of that. I mean, how important it is for them to make sure that they stop these meds.
Well, you don't want to bleed excessively during your surgery, and to Amy's point, we've had instances where patients forgot to stop, and talk about a pain in the butt when everybody shows up, families coming in from California, and Grandpa forgot to take it.
You can't do it.
You can't do it.
Yeah.
But this app will remind them and their family, if Grandpa's a little forgetful, the granddaughter will call, hey, Grandpa, did you stop the medicine? Or they'll take the medicine away from them.
Yeah. Amy, it's 7 days. Now, this is my next notice. It's 7 days before your surgery. Stop taking any natural, herbal, or vitamin supplements. Why is that important?
Many patients are taking over-the-counter vitamin or herbal supplements that are supplemental to their health, however, could increase risk of bleeding or interact with other medications, so we want to make sure that they discontinue those medicines as well. And that's something that sometimes is forgotten because patients feel that it's an over-the-counter medicine and maybe doesn't have any type of side effect. It doesn't count.
Yeah, and it's a habit. They do it every day, right? And they just keep doing it. Okay, now here's the next day. It is important to stop drinking any alcohol at least 2 days before surgery. So I've gotten this 2 days or a few days before surgery.
Correct. So the alcohol cessation is important. Again, it can increase risk for bleeding and also affects our liver, which is how we metabolize many other medicines. So we want to make sure patients withhold from their alcohol.
Would this be as important, Dr. Mishkel, as say the antiplatelet medicine? Could you go forth with?
Well, I think you could. It wouldn't be an absolute stop, but as Amy says, for instance, most general anesthetics are metabolized in the liver, and if you're pushing alcohol through your liver, the way you metabolize alcohol is that you got to do it through your liver, so your liver's going to have to choose. So you do the alcohol or the general anesthetic.
My next notice was, your surgery is tomorrow. You have a new list of items to do to get ready for tomorrow. To see your full list, click on the link below. Okay, so what would be some of those things on that list?
We would provide patients with a checklist for things such as performing their antibacterial scrub that they do before their operation, both the night before and morning of surgery. We would remind them to stop eating or drinking after midnight, which is important for them to have an empty belly when they're undergoing general anesthesia, and just all those pre-preparation. A reminder list of what to bring to the hospital even is included in that.
I just can't believe, if I were going in, I would be so relieved that I didn't have to worry about what I didn't think
It's
about.
all the things that patients are thinking about and worried about, but don't have time to discuss during the surgical consultation. And we certainly don't have time to speak all of those things to them at that appointment.
And what I like most about this is it doesn't give the patient all this information as one bolus. It's given it to them at the appropriate logical time.
When it's most meaningful to them and their family.
And they don't have to worry about losing their list or, what did I do?
It's right there at their fingertips or on their computer.
Next, what to expect during your hospital stay. What happens when I arrive at the hospital? I mean, you even go so far as to tell them where to go, where to park, what time to get there, those kinds of things.
We all know when we're going somewhere unfamiliar, something as simple as not knowing where you're supposed to park can heighten your anxiety exponentially. And also we found that patients, in speaking to them afterward, after their surgical procedure, they weren't aware of maybe the number of people that would be in the operating room or how the operating room would function. And so preparing them and showing them what would happen in the pre-anesthesia area, warning them that there would be a multitude of people in the operating room with them, put them at ease because they were expecting it.
Now it's the day of surgery, and the surgery I chose was this single bypass and the ablation. So right now, the surgeon is cutting through my chest, and what you're getting me, of course, I don't have to do anything day of surgery because I'm knocked out, and it's going to take me a while to get over that. But then you begin again with the day after surgery, because now here I am, I'm conscious again, and already you've got instructions for me, right?
Correct. Patients are well aware of what to expect on post-op day 1, even before they come in for surgery, so as well as their families. So they know that the first day after surgery, they will sit up in their bed. They will stand. They'll take a short walk. They'll be expected to do their breathing exercises. Also, the family members know what to expect when they see their patient for the first time in that cardiac recovery unit. The breathing tube will still be in. They'll be connected to multiple lines and wires and tubes, and that's okay, that's what it's supposed to look like. And so it's giving them a preview of what to expect, and then the patients know ahead of time what they're going to be needing to do to recover
You know, it
faster.
really takes a load off you all too, the health professionals, because if they're not worried, you don't have as much to worry about.
Right, and we can focus on caring for the patient and taking care of them in that critical time period, and the patients and the families know what to expect from us.
I think what patients and their families realize from this app, and specifically from the instructions that they get post-op day 1 through their discharge, is that surgery is a team sport. It has a captain, to be sure, but it needs team members, and that they, the family, and the patient are part of the team. They have a role to fulfill that they have to fulfill to get better quickly and safely after surgery. They have to push themselves to walk. They have to get up and use their little incentive spirometer.
Right.
They have to make sure they take their pain medicines as scheduled.
They're integral members of the team. It's no longer just the provider and the nurse practitioner dictating what the patient and the family members need to do. They take some ownership of that, and they're more engaged, and they're doing better after surgery.
Yeah.
I don't know if you're going to touch on this, but one of the things that Amy and I have discovered through our analysis of the first 150 patients is that because the families are more engaged, because the patient's more engaged, we find that they are more comfortable going home earlier and with less pain medicines.
No kidding.
Yes.
And that's important, because those pain
Right.
medicines aren't good for everybody.
Not good for everyone over an extended period of time, to be sure.
Yeah. Okay, here's the next one I got. Tell Dr. Gregory Mishko what self-care tasks you did yesterday on the day of surgery. Would you perform any? Would you do anything for yourself on the day of surgery? I mean, what would you normally expect? It says take 5 minutes to answer these questions.
Sure. The patient engagement questions are set up to ask questions for the day prior. So the day after surgery, the patients may report that they didn't get up to walk that night of surgery, and we would expect that. A lot of times folks start their post-op recovery questions on post-op day number 2 if they don't feel like doing it post-op day number 1. But it's going to ask them, did you take walks yesterday? Did you sit up? Was your pain controlled? Did you have any nausea? Did you feel supported by your healthcare team? Did they answer your questions? Did they explain your medications? So it's giving patients that knowledge and that ownership that they are in charge and they can ask these questions, and that's going to help them in that recovery process.
And we're monitoring these answers at a central dashboard. So for each patient who's in the hospital at whatever stage of their surgery, we are getting these answers, and we can spend some additional time with our nursing staff to go back to that patient who said, no, I didn't get my pain medicine, or I didn't get walked, and spend some extra time or attention with them.
We know right away if somebody's off track.
Well, that's real. I mean, it's very important. I mean, it's almost like, uh-oh, big brother. But I mean, you need to know that because they're in your care.
Right, right. It's that patient-reported outcome. They're reporting how they're doing.
The next one I got was, I hope you got some rest last night. Now, you should feel a little stronger today, but you will still feel tired. Today, you will keep resting and taking care of yourself. The nurse will keep checking on you often. Remember, when you do a task, check it off. So what kind of tasks would be ongoing, say, 2 days after surgery?
Those tasks would be just those things: walking 4 times a day, using their incentive spirometer, which helps prevent pneumonia after surgery, helps wean them off of any supplemental oxygen, making sure that they are getting prepared for discharge, that they're thinking about what questions and concerns they may have about going home, so that we're starting that process early as well.
Coughing or laughing can be painful right after heart surgery, so this is the next day that I got
Correct.
this one. There are 2 ways to protect your chest while coughing or laughing.
We give all of our patients a Sir Cough-A-Lot teddy bear, and he helps to support the patient's chest and make sure that they're using proper technique when they cough or sneeze or laugh. That helps to prevent motion and pain, as well as preventing any problems with their sternotomy. And a lot of times patients aren't sure how to hold the bear, or they think the bear is just cute, that he's not functional. So this is reminding them to use him.
And the next day then, did you do your breathing exercises yesterday? These exercises are important to help your body recover from surgery. And then it refers you to the breathing exercises article in the library. So I assume that they can click on that and they'll get some more
They can
information.
click on that, and there's actually even a video showing proper technique to use the incentive spirometer. There are a lot of different ways. I've seen probably 100 different ways of patients using it, and there's only a few that are correct. And so patients can actually see how they're supposed to be doing it. So when they get home, if they forget how the nurse showed them to do it, they can refer back to that in their education library.
You can see, as you look at some of these pictures of the open heart surgery that we have, you can see why people, number one, would be afraid to go when you have your sternum cracked like that. It's a very, that's a scary prospect. But it also is, the healing procedure is very painful, isn't it? It lasts you with you for a
Common misconception that
Misconception.
that a sternotomy, the midline cutting the sternum, is
Yeah.
painful. It is less painful than an abdominal procedure. So it would be less painful than
You
certainly.
mean the recovery period? The recovery period? Really?
Yes.
Even though the staples are in there and there's all this,
Yes.
my goodness.
It really
Because
is.
the nerves
not
aren't
cutting
present,
through
I guess.
muscle.
Huh?
Right. It's one of those common things. Oh my gosh, but it heals very quickly.
But as you said, people are very timid to take a deep breath because you feel like you might fall apart. And that's a very common concern that patients have. And so that's why we want to give them this reassurance that these are the things that you should be doing, you have to do in order to recover well after surgery, and that it's okay. It's giving them that reassurance.
On the next day, I got this reminder. Hi there, Mark. Just a reminder that Dr. Gregory Mischel would like you to start your online recovery program. And that says that lasts for the next 30 days.
Correct. So when patients are discharged from the hospital, they are still connected to our provider dashboard and our surgery team by completing their daily health checks. And they're not required to complete the daily health check every single day, but most patients do them daily or every few days. And that allows us to track how they're doing at home. Are they still doing their walks? Are they still using their incentive spirometer? Are they having any questions or concerns? Especially any concerns about their surgical wounds. Patients are able to mark that they're having a concern. They can take a photo of their surgical wound, and then that comes directly, securely to our provider dashboard where we can see if they need to come in for a clinic visit.
And so if somebody's remiss in filling out these several days in a row, does somebody contact them to see?
We do check up on patients who aren't filling out their surveys. We
Yeah,
do.
just to make sure that-
we're able to see.
that they haven't gone astray, or just to
Correct.
make sure that maybe they're in their right mind and they're focused on what they should.
Right. It's another way that we can keep track of them.
Okay, here's the next day I got. Most patients go home 5 to 7 days after surgery. Make sure your family arrives before 9 a.m. to pick you up on the morning you leave. These logistics are important, aren't they?
They are important. So a lot of times our physicians and care teams are rounding early in the morning, and we're wanting to be able to get patients home so that they can get to their pharmacy to pick up their medicine before they close. So we want to make sure that patients and families are prepared for that discharge day.
Hi, Mark. We hope you're doing well again today. There is a new to-do list for you. Log into your account to see this list. Okay, so this doesn't come automatically, but you go ahead and you hit the link, and pretty soon you get it, huh? And that list this is 4 days after or 5 days after surgery. What sort of to-do list would you have for them?
In those post-discharge questions, we remind them that they're going to be signing up for our Phase 2 cardiac rehab program, which is the next step of outpatient cardiac rehab. We are making sure that they were able to pick up their medications, that they don't have any questions about their medicines. We ask them if they've followed up with their family doctor and how that visit went.
Okay. Hi, Mark. Are you raising your legs above heart level for 30 minutes a few times a day? I'll bet you a lot of people don't do this one.
It's actually very important. Some patients, most patients who have the bypass surgery have leg incisions where we've taken the saphenous vein harvest, and there's a lot of swelling that comes along with that and some bruising, and so that elevation and then compression with their compression stockings are really what helps to reduce that and also help the wounds heal faster. And so that's something that patients aren't always wanting to lay on their back and put their toes above their nose, but we tell them that that's very important. So this is just a reminder.
You don't have to raise your toes above your head when you're standing.
Thank
Only if you're
goodness.
very talented.
Thank goodness. It says, do your survey and tell Dr. Gregory Mischel what self-care tasks you did yesterday 5 days after surgery, and you'll get tailored feedback on how you're doing. Does the cardiologist, does he or she see these?
Honestly, although you've used my name,
Yeah.
it would be one of the surgeon's names, and typically I would not. However, if the patient reported an adverse outcome, For instance, they reported to Amy, you know, I'm having palpitations. That might be a sign of, say, atrial fibrillation, which is a very common arrhythmia after heart surgery. Amy would know that quickly, and she would report it to my nurse, if I was the cardiologist, and we might bring that patient in quicker rather than wait around or have them end up in an emergency room.
I was going to say, or send them to the ER for an EKG. We're knowing ahead of time so we can prevent those avoidable emergency department visits and readmissions to the hospital.
We not only want to facilitate getting patients out of the hospital faster, safer, less pain, but we want them to go home preferentially, and we want them to stay at home and out of emergency rooms. So we will work with them and this app and their families to get them back to see us if it can avoid a readmission.
Have you been getting out of bed and sitting in your chair? Okay, now I assume if you've been raising your legs up that you, but not always, I guess, it's important to move your body after surgery. Why is that?
It's important to get up and move. Actually, walking and doing your coughing and deep breathing exercises are probably the two most important things, in addition to taking all of your cardiac medicines like they're prescribed, to help patients recover faster. And people are tired, and they've been through a big emotional event too with this operation, and so it's good to have that reminder to get up and take that walk and get out of bed and try to get back to your normal activities, because we all know that's why we do this surgery, is to give patients back that quality of life and get them back out there.
On the next day, again, I'm encouraged to take my small walks every day, but it also says we have a new survey ready for you. Answer this survey to tell Dr. Greg Mischkel what self-care tasks you did that yesterday, and this is 9 days after surgery now, and your answers will help us. So this new survey, is it more extensive exercise, or what's?
Not necessarily more extensive exercise, but we're also asking patients things about their appetite. Are they eating well? Are they eating a heart-healthy diet? Are they having common problems after surgery, such as constipation or any trouble with their urination? Sometimes after a Foley catheter has been placed in the hospital, you can get a urinary tract infection. So we're trying to be very proactive with addressing these complications. And then a lot of things, such as the constipation issue, patients are able to manage on their own at home. And so then they're directed to that patient education library, where they're given a list of home remedies and over-the-counter things that they can do, so that it avoids that call to the office or visit to their family
doctor. And you know, that's
doctor.
important too, because as you know, Dr. Mischkel, a lot of people, they're reluctant to make that phone call because they don't want to bother anybody, or they don't really know what they would tell them.
Right.
You know, they don't want to say, I can't pee. I mean, they don't want to be able to have to say that on the phone. So this really kind of takes care of all that.
So one of the things that we've noted with this, which both the patient and our staff like, is that the number of, I don't want to use the term unnecessary, but unnecessary phone calls has gone down, and the number of really pertinent phone calls, the phone calls that count, get through to us and get acted on quicker.
Right.
It's been 12 days now since my surgery. How am I feeling? Take 5 minutes today to answer your health check and tell your healthcare team how you are doing. Even at 12 days, you're still keeping an eye on me.
A lot of our patients are still completing those surveys up until the 30-day post-discharge mark, and so they're letting us know that they're doing a good job with their walking. They're putting a message in. They're able to free text messages to us, which is very gratifying for the healthcare team, because you wouldn't always hear those little snippets of information that patients are doing so well. We get notifications such as, you know, thanks again to the awesome surgical team, or you guys are the best. And so that is nice to hear too, that patients are feeling better. You know that they're feeling good and that they're moving along.
Yeah. Okay, and here we are now. Now I'm ready to start exercising on a stationary bike. Wow, add this exercise to the top of on top of walking outside. So now I think we're about, maybe 2 weeks out, huh? So a stationary bike, that would be if you have one in your home.
If you have one in your home.
You're not expecting them to go to rehab yet.
Of course not. Not yet. Some patients are ready to go to rehab in 2 to 3 weeks after surgery, but we just want to reassure them that if they have a treadmill or a stationary bike, they can certainly start using that a few weeks out. That will just help prepare them for that phase 2 cardiac rehab.
And then finally, this is one of the last ones that I received. You have a follow-up appointment at the hospital soon. Make sure you have this date written down on your calendar to find out more what to expect at this appointment and log into your program. So what would they expect at their follow-up appointment?
At the follow-up appointment with the surgical team, we're making sure that their incisions are healing well, that their sternum is stable. We're making sure that their lungs are clear, their heart rhythm's normal, their vital signs are good, that they're getting along in their recovery and not having any complications. We address any medication changes, make sure that they're going to see their cardiologist for follow-up, and then talk about next steps, how to prevent this from having to happen again. So we do a lot of teaching as far as diet, exercise, stress management, and then making sure that they're getting referred to cardiac rehab.
I'll bet the surgeons and their staff really like this. This simplifies their life a little bit, doesn't it?
It's been very well received. With anything new, there was a change in workflow, but our team was phenomenal as far as being very embracing of the new protocols, and we see that how well patients are doing and how well they like it, and so that's extremely motivating for us as well.
How long has this program been in existence?
We started launch the end of July of 2017. And so we have 180 patients have enrolled and completed the program as of today.
And your take as a cardiologist on this, it's probably relieved some of your, well, actually not cardiologist, but the executive medical director.
Right.
It's relieved some headaches for you, hasn't it?
Right. So this kind of program falls into a category called enhanced recovery after surgery, or another category it falls into is a perioperative surgical home. And so this allows us with limited resources to address the entire continuum of surgical care, beginning importantly with before surgery, through surgery, and the most important first 30 days after surgery.
It's terrific. I think if I were a patient, well, I was a mock patient, but if I were a real patient, I think I would find this extremely helpful. They've become more adept at finding things on their own and helping themselves and not waiting for somebody to pull them along.
Right, and that's the way that healthcare is moving, just like everything else. When we want an answer, we want it right now. It's difficult for patients to have to telephone the office and maybe wait for a call back, but they're able to get some information right away, and then we see that and are able to contact them as soon as possible if there's a concern.
Amy Durako, thank you for walking us through this
Thank you,
process.
Mark. It's my
Dr.
pleasure.
Mishkel?
Thanks, Mark.
Thank you. And isn't it great? We love to bring you new advances in cardiology, and in this case in surgery as well. And a smartphone, a computer, you can receive all this information, and it relieves your family and you quite a bit, I think. We hope you've enjoyed watching it. Well, that's been CARDIA. Remember, we all have a heart, and the more we know about it, the better care we can take of it. Thanks for watching.
CARDIA is brought to you in part by H.D. Smith Foundation, a private grant-making foundation in Springfield, Illinois. Abraham Lincoln Capital Airport, daily flights to Chicago on United and to Dallas on American Airlines. Online at flyspi.com. Eck, Schaefer and Punk, LLP, and ESP Wealth Management, LLC, specializing in fulfilling all your accounting and wealth management needs. Securities offered through First Global Capital Corporation, member FINRA and SIPC. Investment advisory services offered through First Global Advisors Incorporated. Prairie Heart Institute, nationally recognized, locally committed. Online at prairieheart.com. And viewers like you, thank you.